Hi guys, my name's Craig. I'm the lead dentist here at Birch Grove Dental Practice. I've had quite a few people and patients daily ask me how should I brush my teeth and why and should I floss. So I thought I'd put a video together just to give you my professional advice and on what I do and why and what can happen if you do or you don't brush your teeth. But mainly everybody should brush their teeth at least twice a day. So using a manual or an electric toothbrush, twice a day last thing before bed and first thing in the morning. Ideally, if you can use an electric toothbrush, I think they're great. You just turn them on, make sure you've got a rechargeable one. And when you're brushing your teeth, make sure you brush not just your teeth, but make sure you brush your gums as well. So make sure the toothbrush is on. And rather than just scrubbing back and forth, make sure you do little circles with the electric toothbrush. Make sure you brush high up on the gum. Same for the bottom teeth. Make sure you go really nice and low down to the gums. But also don't forget you've got your tongue side of your teeth on the bottom. So make sure the brush is down there too. Again, always half on the gum, half on the tooth. And then same for the top teeth. Make sure you're brushing the roof of the mouth really well. And again, all the gum along the front. Brushing your teeth with an electric or manual brush should take about 2 to 3 minutes. So if you're doing that as well as flossing or cleaning between your teeth, that's pretty much as you can do with regards to brushing. And when we say the word flossing, everyone cringes and thinks, okay, I should do it a bit more often, or I should do it a few more times. Again, ideally with flossing, if you can, use something which is quite smooth and quite thin. I like this one. This is by Oral-B, it's satin tape. Make sure you tear off a big piece. And the idea is you just want to clean where the teeth are touching nice and tight. So you just want to be able to click it in and click it out. Now if you don't do it every day, it will hurt a few times. And if you don't do it every day, you might get a little bit of bleeding if you do it too hard. But you haven't got to go back and forth. So you've literally just got to click it in and then click it out. So if I show you what I do with my top teeth. And that's it. So if you can just walk that around your teeth, same with the bottom. If you do get a snag or it's a bit tight, don't be afraid just to click it in, let it go, and then pull it out the one side. So I'll demonstrate that now for you. And there you go. So don't panic with flossing. You haven't got to go back and forth like a saw. So if you can do that once a day, brilliant. If you can do it twice, ideal. But even if you forget every day or so and you do it every other day, it's much better than not doing it, because your toothbrush will never ever get into those tight spaces. If you've got spaces that are a bit too big for flossing, or you've got quite big gaps, then there's another option. You can use little brushes that go between your teeth. So if you can get them, they come in lots of different sizes. I like these little rubber ones, they're quite soft. And then what you can do is, with regards to any spaces, just pass the brush just through like so, and then out the other side, and then onto the next gap. And if you can walk those around every gap and then brush your teeth, you'll always get in between your teeth to keep them nice and clean. It'll clean your gums, it'll clean your teeth, but that's where most problems start, is between the teeth. If you get food build-up or plaque stuck between the teeth, the plaque then can damage your gums, it can damage your teeth, and that's where most fillings start, actually between the teeth. So that is really important, as well as the electric brush or the manual, doing it twice a day if you can. So that's probably my best advice with regards to brushing, and I hope to see you soon. Bye.